Hello, I'm Robert. We fact check stories that scare you, and I also explain some of the positive things that are going on in the world. And this is about the vaccines, and we're getting these scary stories, and they're just so far off the mark. Because, as the World Health Organization has explained, we've got the light at the end of the tunnel. We've got these wonderful vaccines, and we've got huge capacity to make them. And the main problem really is that we are not transferring technology to the countries that could actually make their own vaccines. And AstraZeneca is the only vaccine company that is doing that. So part of the bottleneck that we have at the moment is that only a few companies in the wealthy countries actually know how to make these vaccines, and they aren't giving the permission to other countries to make them. So that's part of the reason we've got this bottleneck right now. And AstraZeneca are the only company that have transferred their technology to other countries, to India and South Korea, and other countries are also going to be involved later on as well. And even so, even with this very unequal situation, then still we're going to have huge numbers of vaccines by the end of 2021, and by 2022 the numbers are vast. So I'll explain that in a minute. And the reason we have a huge number of doses actually pre-ordered by the wealthy countries. They've pre-ordered enough vaccines for their citizens many times over. So like with Trump's Operation Warp Speed, and then Germany, they've funded Pfizer, and the United Kingdom funding AstraZeneca, and we gave them billions of dollars. And as a result, these vaccine companies, they had zero risk. Even if all those vaccines had completely failed and never actually done anything to protect anyone, those companies wouldn't have had any hit on their finances from that. So these new vaccines were funded by the public tax dollars. And the World Health Organization is saying that given that the vaccines were funded in this way, then could the wealthy countries empower the transfer of technology like AstraZeneca has already done? And if they did that, we could hugely increase our vaccine capacity very quickly. And I've been watching the World Health Organization. I watched just about every press briefing all the way through ever since January when this thing started. And most recently, the World Health Organization they've been talking over and over about this, and countries pleading to the wealthy countries from the poorer countries, heart-wrenching pleas, saying, find a way to transfer the technology. We know how to make these vaccines. We know how to make vaccines. We've got the technology. The only thing we don't have is the intellectual property and the transfer of the know-how to make these specific vaccines. And even with things like Moderna and Pfizer, then there are plenty of clever people in other countries around the world in their universities, and they're working with local companies. They would be able to make these vaccines if they were to explain the specifics of how they make them. Intellectual understanding is not something that only people in the wealthy countries can do. The world is full of very clever people, and they just need to be shown and given the permission to make these vaccines. So this is a way that we could hugely increase the vaccine capacity very quickly. Within a few months, we could have vastly increased world vaccine capacity. We have a huge capacity already, but we could hugely increase it. And one way I like to look at this is think about our future civilization, say 100,000 years from now. And they would look back at us, just like we look back at the early humans a few tens of thousands of years ago. Humans originated 200,000 years ago, and it'd be 100,000. If we look at human beings 100,000 years ago, we would think they're very primitive. Well, 100,000 years from now, if they look back at us, they will think, they will not be impressed by our technology. They won't even be as impressive as paper tape and punch cards are to us, what we have now. It'd be more like stone tools and fire. But they might look back at our era as the time when we first made the step to becoming a fully logical and rational civilization. Ethical, logical and rational. Because what we're doing right now, it's not rational. It doesn't make sense. The wealthy countries, have poured billions of dollars into making these vaccines, and it would be a huge benefit to the wealthy countries if the vaccines were rolled out around the world and if everyone was vaccinated. We've already got the variants. We have just heard a few days ago that the South African variant is actually been shown it has developed the ability to infect non-transgenic mice. So that's another animal reservoir. We already had the minks, now we have mice for the South African variant. The other variants can't do that, just ordinary mice, not modified in any way. They don't know if it has yet transferred to this animal reservoir, but obviously the more that we have transmission, the more possibility that mice may get it. And then if the mice get it, well, we don't know if it can transfer from mice back to humans, but that's when you begin to have concern about things like that. And the longer it evolves, the more it develops new capabilities, new surprises, to transfer to other animal reservoirs, evading the vaccines. And it doesn't make sense to just let, even for the wealthy countries, just self-serving, it doesn't make sense. It's totally illogical not to empower other countries to stop the disease. And then, because the variants arise when you've got a lot of transmission. If you've got no transmission, you won't get new variants. So the only reason we've got all these variants is because of the massive community transmission around the world. We've got 3 variants of concern, and they arose probably not coincidentally in the United Kingdom. They don't know where they arose, but that's where they were detected. United Kingdom, Brazil and South Africa all had huge outbreaks, and there probably are other ones which haven't been detected yet in the world, because and that's why the World Health Organization is also hugely expanding the gene sequencing capability. So we do have, the future is very, very bright for next year. We look forward to 2000 and this is 2022. These are the tables from the vaccine dashboard, and you can see in 2022 we have enough vaccines. We will have enough vaccine capacity as long as we keep up with the funding and the expansion of facilities and so on. And this is based on the reported COVID-19 vaccine production capacity for 2022. We will have enough to fully vaccinate the entire world population 4 times in 2022. And in 2021, that assumes that all the remaining vaccines pass clinical trials, but they are, the ones in clinical trials already, 4 have been withdrawn from phase 1, but they, with more work, likely could have gone all the way through to phase 3 and been approved. But they withdrew for various reasons, and basically to focus on other things that they can do better, given there's so many successful vaccines. So it would be no surprise if all the vaccines it's very remarkable that this is happening, but it's the way it's going. It would be no surprise. The inactivated vaccines, they seem to be working well as well from the preliminary Chinese. All the technologies being used are working fine. All the vaccines are being approved. So we may well end 2021 with at least 21 billion doses of vaccine. That's the projection on the coronavirus vaccine tracker. 21 billion doses if they all get approved. And that is enough to fully vaccinate the entire world population and have with 2 billion extra doses, so 2 billion people could be vaccinated a second time in the fall. So we have huge vaccine capacity for later in 2021. And another thing not many people realise is that Pfizer is still the very best of all the vaccines that we have so far. And Pfizer was the very first one produced. There's no way that Pfizer is the best possible vaccine. It can't be. It'd be totally improbable that the very first vaccine produced is the best possible with the exact dose regime it has had when first produced. That would be incredible. So, and in fact they already have ways of improving the Pfizer vaccine, and particularly the Hexapro variation on a way of stabilizing the Pfizer spike protein. And if they use Hexapro, and this is already being tested, then this will lead to it being much more stable, so it can be stored in fridges at fridge temperature, not needing ultra cold chain. And it will mean that once the messenger RNA gets into a cell, it produces 10 times as many spikes that are fully stable, that are the right shape to trigger the right antibodies against COVID-19. 10 times as many. So they expect it to be a much more effective vaccine with the Hexapro variation. And so that's just one example. There's a lot of work being done on improving the vaccines. So this is just the first generation vaccine, and already with the first generation and with the B117 variant in Israel, then the reported by doing one of these where they do a matched cohort thing, where they look at the effectiveness of the vaccine, then they're estimating that it is stopped, that the Pfizer vaccine in Israel, and Israel you see as part of its agreement with Pfizer is doing very detailed study of what's going on, and they have found that the Pfizer vaccine stops, and this is with the B117 variant, so it's one of the more transmissible variants, it's stopping 97 out of 100 of the dose of the cases you would have otherwise of symptomatic, and it's stopping 94 out of 100, so that's only 6 instead of 100 it would be transmitted to. If normally it would transmit to 100, it would instead transmit to 6 with the asymptomatic. So as you can imagine, that means that any super spreader event is going to stop very quickly. Even if at 100, even if everyone was infecting 3 people, or even 4 people, that's still enough for the case. And if you do enough to just say stop all except, say you had 100 cases, and then you stop, you're just managing it to now just above 1, then they will infect 6, and then it's gone. And even if it's 4 times as many, then they will infect 6, 12, 24, and then it's gone. 24 would infect 100 would infect 24, would infect 6, would infect, and then it's going to be gone very quickly. So you can see that with such an effective vaccine, transmission, any cluster that develops is going to soon fizzle out, as long as everyone's vaccinated, especially once they vaccinate the children. So we've got this wonderfully effective vaccine, and any country in the world, most of the countries in the world, the ones with universities, and where they've got a good university with a good medical research, good capabilities, good technology, then many of Latin American countries, for instance, and many countries in Africa also, could actually make the Pfizer vaccine with technology transfer. But instead, all they can do is buy it, and they can't afford it, and all the doses have been pre-ordered anyway. There's hardly any spare capacity for the Pfizer now. So this is why if we looked back at this from 100,000 years developed civilization back to us now, and then we look at this and they would say these people haven't quite developed community thinking. They haven't quite developed a civilization yet. they're just at the start of a development of a proper civilization. They're working together. They work together on climate change. They've done their first global rollout of a vaccine in 1 year, but they're not fully logical, they're not fully mature yet as a civilization, because they haven't understood this point, or if the ones who do understand this point just not getting hurt. So if we can make this transition, then I think this is the start of being fully civilized. We will be properly civilized once we start doing this. I don't think we're fully civilized at this stage. We're not really a proper civilization yet, as we understood. If I go and look at this, this is not what should be happening in an advanced civilization. And if we ever meet extraterrestrials, I think they will think we're just on the very first steps of becoming a civilization. At this point, they wouldn't say, "Oh, how wonderful their technology was." That wouldn't impress them at all. Obviously, 100,000 years, that'd be just like us looking at cave paintings and thinking, "Oh, how wonderful their painting was." It's not going to be like that. I mean, there could be some things to wonder at it, some marvels that we've produced, just like we marvel at the cave paintings. They wouldn't think, "Oh, what an impressive civilization that we've got." So this is an example. This is Professor James Gita Hakim, and he's from the University of Zimbabwe, or he was. Sadly, he's passed away. He was a topmost HIV specialist involved in fighting HIV in Zimbabwe. He was a foremost heart specialist at the University of Zimbabwe, and he wasn't an academic who spends his time in his desk. He was involved in frontline clinical work. And he died on the 26th of January, and he was never offered a vaccination against COVID. And you get this in obituaries, but this is obviously really heartfelt. He has left a void that will be so difficult to fill. They mean so difficult to fill in the Zimbabwe healthcare system, because they have such a shortage of doctors there. Only 2.1 in every 10,000, 2018 data. Compare that with 25 for every 10,000 in other countries. Yet, and again, 100,000 years old civilization would look back at this, if they come across this data in their archives, if they manage to preserve something like the Internet Archive, and they've got their scholars looking back at what happened in this year, if it's still preserved, they'd look at this data and they'd say, and you've got 25 doctors to every 10,000, they've all fully vaccinated in the United States, all fully vaccinated in the United Kingdom. And then they look at Zimbabwe, and they've only got 2 doctors for every 10,000, and none of them vaccinated. How does that make sense? And then I worked out that with a population of 15.65 million, using that 2.1 figure, which is from the World Health Organization, and that works out at a little over 3,000 doctors. I mean, it's possible to have a few more now. They've definitely been working on increasing their medical capabilities, but whatever it is, it's in the few thousand. They've got a few thousand doctors, and with this technology transfer, then that will make a huge difference. Not only that, we've got doses that could be given to them right now, and so that's another thing that they look back and they say, why aren't they giving their doses? Why are they not prioritizing these people who so desperately need it? Now, there are some good actors here. So India has been an example for the whole world on what it has done with its vaccine doses. And so India it so much needs vaccines itself. And India is one of the world's big vaccine manufacturers. So it is selling doses to the rest of the world of AstraZeneca. And it's so when we buy our doses in the United Kingdom, then some of them come from India. And so but it keeps half its doses. It sells half, it keeps half for itself of the AstraZeneca vaccine, and its own natively, it's got its own vaccine as well, they developed themselves. And they give half of their own doses to the neighbouring countries, to Bangladesh, to Sri Lanka. And look at this, like Bangladesh reached 0.5% long before India itself did, and reached 1% long before India itself did. And India is only just catching up on the percentage of Bangladesh. So this was incredibly generous of India. Oh, sorry, no, that was Sri Lanka, sorry, Sri Lanka. Then look at Bangladesh, then yeah, Sri Lanka reached those doses before India, then India, this is, look at what Bangladesh, and Bangladesh reached 1% long before India itself did. And so India hasn't been niggardly with its doses and it produces for itself. And France is another example to show, and France is not, so that's about India. France is another good example here. So France isn't giving away half its doses, but France is giving away 1 in 20 of its doses. And that still is it's a lot for a country in Africa that's got no doses yet. And the United Kingdom, at the moment, I just checked the figures, we are vaccinating 500,000 people every day in the United Kingdom. So if we were to give away just 1 in 20 of our doses, then that would be enough for 25,000 doses we could give to Africa every day, and we'd hardly notice it. So we could vaccinate all the medical workers indeed that is not, I don't know how many countries medical workers we could vaccinate with just 1 day's worth of doses from the United Kingdom, with just 5% of the daily, of 1 day's worth of doses. Just 1 day of doses, 5% of 1 day of doses from the United Kingdom could make a huge difference to Africa, just 1 day. And imagine if we did that every day. So, and this could really make a huge difference to the vast inequity if the that we have in the world. There's a short WHO video that I've shared here. I'm not going to play it now, but you can easily find it, and then try playing this one. We need there's this one about vaccine equity, and then that's about vaccine equity. Sorry, this one about just wait a minute. It's not fair that the health workers. I've actually got the. I can actually read it out, a part of it. So this is Dr. Mike Ryan said that. What we do know is they're going to stop people dying. We can't have a situation where frontline workers, health workers, risking their lives every day, and most vulnerable people are not accessing vaccine. And we've reached that situation, we already have reached that now, where the perfectly healthy people have been vaccinated in the wealthy countries like the United Kingdom, United States, and frontline health workers and vulnerable people are not. It's not fair, it's simply not fair. And but also, we won't recover together unless we do this. There will be long-term economic impacts. So while the healthcare while countries in Africa, their healthcare is suffering, and in Brazil, it's appalling what's happening in Brazil. They are rolling out their vaccine pretty fast in Brazil. But even so, we could make a huge difference with to that as well. Imagine if Brazil had been empowered to make the Pfizer vaccine in December, say. What a difference that would have made. And then look at, with the AstraZeneca vaccine, that and Brazil is very strong technology, very strong in medicine, very strong in vaccine. They've made the AstraZeneca vaccine factory as well, and they actually built a factory especially to make the AstraZeneca doses in Brazil. And they could have certainly made a Pfizer factory if they'd been given the permission and the transfer of technology. Very clever people there, and very strong experience in medicine. So that's an example of a country that could right now be producing Pfizer doses by the millions if they'd been empowered to do it. And then this is really quite grotesque, I think. I don't think the public quite realise what is going on. I don't think politicians quite realise. So at the same time as we have this shortage in the rest of the world of doses and people dying on the front line, health workers dying, the United States has tens of millions of AstraZeneca doses sitting on their shelves. Just sitting on the shelves. And then they get people talking there, the doctors in the United States, and then they're saying, reassuring the public that these vaccines are not going to go off, they're going to stay safe, they're safely stored, and then they're not going to lose their potency. But they shouldn't be sitting there at all, they should be going straight into people's arms. It makes no sense for any country to stockpile vaccines at this point in such a desperate pandemic, desperate situation. No sense, absolutely no sense. And then that's another thing, that this hypothetical civilization, well, our future, there will be, I'm sure, I don't see ourselves going sick, that doesn't make sense. We just, we're amongst the least at risk of all the mammals on Earth because of our technology. And so there will be a future civilization 100,000 years from now of human beings, and they will look back at this. And I think they will look at this and they will see records from our time, much more robust records than we have of even 1,000 years ago. And they'll be able to look at it in detail, and they just will not be able to make, I think they will be baffled by us. I think they'll find it quite puzzling that the way we've dealt with this pandemic. They will see a big step forward from what happened with AIDS, but I think they'll still find it very baffling and strange and very primitive. I don't think they will see us as civilization quite yet. And as he says here, unless we start to bring all countries out of this, we won't be covered together. There will be long-term economic impacts if we leave countries behind. We're all in this together. We have seen things over the last number of years that scare us all for the future. This pandemic, climate change, racism, authoritarianism. We simply need to start doing the things that turn the tide on this. And this is one of the first opportunities we have this century to send a signal to the future, like these people 100,000 years from now. So he's obviously, I think I may have got that from here, I've forgotten about that, the idea of choosing our future civilization, that this will be a fairer world. We will share more, we will do more together to make our planet, our environment and our populations healthy. So, as I say, it's not sensible even for our own self-interest, the damage to the health system and economy in Africa and the impact on the world economy. So, as I said, there's the encouraging signs, and US loaning 2.5 million, it did loan to Mexico, and so COVAX is saying, you've got these tens of millions of doses, you've loaned 4 million, but loan more of them. If you're looking for someone to loan them to, we can get them into arms straight away. Right now, today, we can get your tens of millions of doses, and then just swap with our batch, which is later in the queue, just swap positions with our batch of AstraZeneca. That's what they're asking the United States to do. And so, as yes said, if only other countries were generous as India, China is doing it. With China, it really brings into focus how it really benefits a country to give vaccines to other countries. So in case of China, they've eliminated it locally, and their only outbreaks are imported cases. So it obviously makes sense for China purely as self-interest to help other countries to vaccinate as fast as possible. Vaccinating within China won't do very much to stop the pandemic, because they're not going to get infected anyway. The fastest way that China can stop its own can protect its own population is to vaccinate the rest of the world. So it's not just vaccine diplomacy, it makes total rational and logical sense for China, which has the capability to make billions of vaccines. Then it's no wonder that China is exporting its vaccines to the rest of the world. It makes completely, just in total self-interest, is the only sensible thing for China to do, is to help the rest of the world to vaccinate. Because it's already eliminated it in its own country, and whenever there is an outbreak in China, they have very efficient test, trace, isolate. They immediately stop it very, very fast. Now they've got the vaccine on top of that. They could surge vaccinate any hotspot in China. So China's priority, China's being rational here. I'm not, and I'm here, just like when the World Health Organization praised China, I'm praising the doctors in China, the epidemiologists in China, the healthcare workers in China. I'm not praising an authoritarian regime that does things that are against human rights. I'm praising a very dedicated and effective medical teams and epidemiologists in China, and they rightly deserve praise for what they did to stop their pandemic. And so, for instance, they've given 1 million doses to Pakistan, and that is the only sensible thing for them to do. And spread roughly 500 million doses to more than 45 countries, the Associated Press. And they can make at least 2.6 billion doses this year from just 4 of the Chinese many vaccine makers. So now the United Kingdom, the United States, one place that they have done some things very positive is they are the two of the top contributors to COVAX. Indeed, I think the United States is by far the top one now. COVAX has raised $6 billion, and of that, the United States provided 2/3. So 2/3 of the COVAX doses are actually financed by the United States. So in terms of finance, the United States is giving, but it's not in terms of technology transfer and not in terms of actual early doses. So this is why the World Health Organization are recommending. So let's now go back up to the TRIPS agreement, and I'll explain that. When I talk about these things, I often go a bit out of sequence with the way I actually put it on the page. Somehow when you talk, it sometimes comes out in a different order of the way you talk than it appeared when you put it on the page. So now I want to explain about the TRIPS, and let me see, I'm just going to go down a bit and find the list of 4. There we are. No, not the TRIPS agreement. Sorry, just before. There we are. Right. So this was just a couple of a week or so ago when Dr. Tedros outlined most of what I say, in fact just about all of what I'm saying here, comes from the World Health Organization press briefings and then following up the leads from what they say and checking out what they said. So this is Dr. Tedros, and he said that the 4 approaches to increase the vaccine supply. First is to connect companies. So you probably heard how Johnson & Johnson have connected, and Biden helped connected Johnson & Johnson with Merck. So Merck, who they had a vaccine, but they in phase 1, but then they withdrew because it didn't seem to be as effective from even the phase 1 studies as the leading ones that have already been approved. So they thought, this is not, what's the point in adding another vaccine when there's so many already and ours isn't quite as effective as theirs. So they moved to doing other things. And so Biden has been like the matchmaker between Johnson & Johnson and Merck. So Merck is doing the fill and finish, which is putting the vaccine. So Johnson & Johnson make the vaccine and Merck put it in the syringes. The World Health Organization is offering to provide a matchmaking service to any other company that has got plenty of capacity to make the vaccine and is looking for fill and finish. And there are many companies around the world that can do the fill and finish. And the World Health Organization can now put them in touch. The second thing that they say we can deal with the vaccine inequity is voluntary licensing. So the encouraging the likes of Pfizer, Moderna, Merck, Johnson & Johnson, Novavax to voluntary license at no cost. So they don't take any they don't get any money from doing this, but they're encouraged to do this. Then they voluntarily license, just like AstraZeneca has done, and transfer the technology, explain how to make the vaccines. And this, since these are publicly funded vaccines, all the taxpayers have actually paid for these vaccines. And the vaccine manufacturers, they took on no risk at all from making these many vaccines. And so it only makes sense that we should then, if we can encourage the vaccine manufacturers and just actually require them, if the governments that have actually funded these vaccine manufacturers, they can incentivize them and encourage them, pay them if they have to transfer the technology for its vaccine to other countries around the world. This would hugely increase the vaccine supply in the world. And then the final version, the next version is 3, which is a coordinated technology transfer. And I did that with H1N1, with the universities and manufacturers licensing their vaccines to a global mechanism. So the World Health Organization would coordinate a global mechanism for licensing the vaccines. And licensing the vaccines throughout the world. And then it will also facilitate training the staff and coordinate the investments in the infrastructure. Because these countries are willing to pay out to invest in the infrastructure to make the vaccines. So this would be more transparency and a more coherent global approach, and increased production capacity, not just for this pandemic, by putting this mechanism in place for pandemics of coordinated technology transfer when you need to, and this will be ready for future pandemics, and we'll be able to do this very fast, and it can also be there for routine immunization programs as well. And they did that for H1N1 in the mid-2000s, I think that is. And then the fourth thing they can do is to invoke TRIPS. So I just want to explain TRIPS. And then this is the, if I go up, where's TRIPS? Let me just, there we are, TRIPS. So the World Health Organization, so not the World Trade Organization, it's a part of the World Trade Organization. All the countries shown in green here are members. And they are permitted, according to the way the World Trade Organization is set up, to issue a compulsory license. Bangladesh has done that. As an example, it already produces remdesivir under this arrangement. So you might ask yourself, then why doesn't Brazil just issue a compulsory license to make the Pfizer vaccine, say? Well, the reason is because when these countries have tried in the past, then they get retaliation from the wealthier countries. For instance, Thailand tried to issue a compulsory license for an HIV drug, and Abbott, whose drug it was, they said they withdrew 7 new drug applications from Thailand. So 7 drugs that Thailand wanted to buy from Abbott, they couldn't buy anymore because Thailand issued this compulsory license for the HIV drug. And another example was that trade sanctions from the United States threatened trade sanctions to Thailand to stop it producing a generic version of an HIV drug. And they're using this TRIPS provision. Then India, in the case of India, then they faced patent infringement lawsuits. So the wealthy drug companies, they can take up lawsuits in India to stop them producing a patented cancer drug. In that case, eventually, Bayer lost their legal case, but they did this big legal case to try to stop India from making its patented cancer drug under compulsory license under TRIPS. So this is why these countries are very nervous about using TRIPS to make, for instance, it's not just the vaccine, it's also the therapeutics. Like, for instance, some of the therapeutics, the dexamethasone, that is already generic, but some are not, like remdesivir, and there are several others that they could make under TRIPS, and it would make total sense to make it because they desperately need these therapeutics to treat their patients, but they can't use them because they're too expensive for them, and because they can't issue a compulsory license under TRIPS because they're afraid of retaliations such as trade sanctions and withdrawal of other drugs if they do a TRIPS compulsory license. So the World Health Organization is saying that we should do a world waiver, and the way that Dr. Tedros put it is, and I've got this in bold, it's underneath one of these things. And what I'm explaining just now, I think very few people in the world really understand, really know what is going on. I didn't know this until today. I think until today I didn't really fully understand. I knew about TRIPS, but I didn't understand why countries didn't use it. Until today, yesterday, a few days ago, some of these things I've only discovered today by following up the links from the World Health Organization and what they said. And as way Dr. Tedros put it is, if now these provisions are there for use in emergency, this TRIPS agreement, by which countries are legally permitted to issue a compulsory license. Now, when you issue a compulsory license, let's just explain how that works. When you issue a compulsory license, then you're only permitted for the duration of the emergency, obviously, and your license, your compulsory license under TRIPS, will only let you make it for your own country and for other countries that have already issued a compulsory license. So, for instance, if India issues a compulsory license to make the Pfizer vaccine, and they're not going to do that, but just suppose they did. And then, if Bangladesh also issued a compulsory license, then India could export the Pfizer vaccine to Bangladesh. But it wouldn't be able to export the Pfizer vaccine produced under the compulsory license to the United States. And then, as for the cost, then they, under TRIPS, they reimburse with whatever they consider be a fair recompense, which is obviously going to be much less than what is normally sold for, because they are not a wealthy country. So they decide for themselves what would be an appropriate level of recompense to pay to Pfizer. Say, suppose they were doing a compulsory license for Pfizer, then they would say, well, we're going to pay you this much for your vaccine, and Pfizer will have no say in this if it's done under TRIPS. And so World Health Organization is saying, remember, this is the fourth of the things. The third was this, which, if the third thing would be another way of doing it. So this fourth way of doing it is to have a worldwide waiver and say, and just basically for the wealthy countries, to tell the weaker economies that it is okay to use TRIPS. That's basically what they're asking for. They're asking for the wealthy countries to say, we are not going to retaliate if you start making these vaccines onto TRIPS and issue a compulsory license. And again, it's not really the only ethical thing to do. It doesn't make sense in terms of purely self-serving. It is not benefiting the United States for people to die in Africa. And these people are not going to buy the Pfizer vaccine. They just can't afford to buy the Pfizer vaccine. There's no way that Zimbabwe is going to buy thousands of doses of the Pfizer vaccine. They're going to wait for the AstraZeneca ones. There's no way that Brazil is either. They're using the CanSino, I think, or one of the Chinese vaccines, and AstraZeneca, and they're not going to be buying loads and loads of Pfizer vaccine doses because it costs too much. But let them do it under compulsory order, under TRIPS, and there's no real downside for the United States on that. So Dr. Tedros says, and in fact there's a big plus for the United States. How does it benefit the United States to have people dying in Brazil? Doesn't at all. So, and so it's not just the vaccines, it's also the therapeutics. And there are going to be many more therapeutics coming along this year. We expect many therapeutics. We expect by the end of 2021 to be there are several hundred therapeutics in clinical trials right now. And even if only 1 in 10 of those actually passes the clinical trials phase 3, then that is still going to be dozens of new therapeutics to treat COVID. And some of them reusing and some of them totally new drugs designed to treat COVID. So those again, it'll be the same thing with TRIPS. If we don't do that, then it'll be only the wealthy countries that will be able to use the most effective vaccines, except for ones that are reusing drugs that are already generic. So then we're going to have a huge inequity there as well, that by the end of this year, if you've got COVID in the United States, United Kingdom, then it's no longer, there's very much reduced risk of dying, but these therapeutics, if it's like AIDS, so that was the situation with AIDS, that it was already no longer a thing that people were scared of in the United States and the United Kingdom, and yet people were dying by the thousands, hundreds of thousands in Africa at the same time, because they didn't have access to the same therapeutics. And again, they couldn't use TRIPS. So, and it took a long time before they eventually managed to develop a way for them to use these vaccines, use these therapeutics to get through these hurdles in the case of AIDS. And so the World Health Organization is saying that we just shouldn't have this long process that lasts for years, where eventually 2022, 2023, eventually we find that a way for the weaker economies to start using the most effective drugs, the most effective vaccines. That is just not right. So they're saying these provisions are there for use in emergencies. That's what Dr. Tedros said. If now is not a time to use them, then when? This is unprecedented time, and the WHO believes this is a time to trigger that provision and waive patent rights. And we thank South Korea and India for their proposal to the World Trade Organization to waive patents on medical products for COVID-19 until the end of this unprecedented pandemic. So it's only for the duration of the pandemic, only for medical products for COVID-19, including vaccines and including therapeutics. And they're saying this is the time to just waive the intellectual barriers that are preventing them. I recommend, so do please listen to them explain, to Dr. Tedros explain there, and listen to what Dr. Mike Ryan says there about how it's not fair, and listen to this, and then this is the positive thing at the end. So I say, I possibly frame all these things. So it's really incredible stuff that's going on. It's wonderful stuff that's going on, and if we follow the example of Australia, so this is what Dr. Mark Ryan says. Read this at the end. If we follow the example of Australia, of strong public health response and vaccine equity as well, we can make this pandemic history. We can all be back to normal. We won't need to be physical distancing. We won't have these repeated lockdowns. We won't have new variants arising. Indeed, we can certainly eliminate it. Any individual country can eliminate. We've got these wonderfully effective vaccines. We've got the Pfizer vaccine, as I think I explained, in Israel. That already could eliminate it just by itself. It's only a first generation vaccine. So we can make this pandemic history, and we can make it will be history eventually, probably sometime in 2022, but we can make it history in 2021, largely controlled throughout the world. There's no reason why not. And so we've got to keep on doing everything and with the vaccine added to everything else, and empower the weaker economies in this way to make their own vaccines, donate vaccines whenever we can of the ones we don't need, give a small percentage, give the 5% of our doses from the wealthier countries, and transfer the technology in whatever way we can, either invoke TRIPS or any of the other 3 measures that the World Health Organization suggested, and we can make this pandemic history. Do it all, and we can make this pandemic history. So I'll put this in the in the video description. I'll put a link to my article. Do please like and share this video, and make your own videos. If you are a YouTube influencer, then explain this. But if you do this, then do link to the correct sources, to the World Health Organization. Rely on reliable sources. Check your facts before you start talking. Make sure you know what you're talking about as best you can, and put your viewers, link them to where they can find out more and check everything themselves. Do it all, and we can make. Yes, we need to do public health measures to do it all, and we can make this pandemic history. We can make this pandemic history, and so it's what the United Kingdom government is doing, what the United States government is doing. They're not being rational, they're not being logical, they don't even know what they're doing, I think. I don't think they realise how the effects of their actions on the rest of the world. And they are our representatives. The people we vote for, the people who are supposed to be acting for us. And they are not acting for us. They are not protecting us if they are keeping the vaccine technology to themselves. By keeping the vaccine technology to themselves, with the exception of AstraZeneca, that is doing it right. They are not protecting their own populations. They're not acting in our own best interest, or the rest of the world. And I think few people would say, imagine if you were in a queue with, and this doctor was in the queue as well, and he's an expert. You know that he's the foremost HIV specialist, foremost heart specialist in the University of Zimbabwe, and that he's working on the front. He's a frontline worker working on helping people with COVID. Imagine that you were in a queue, and this person was there, and then you're there, unless of course you are yourself a frontline worker or are vulnerable or very elderly yourself. Then who would you say, oh, I'm going to go first because I deserve this vaccine, or would you say, go first before me? And I think nearly anyone who's got any decency, anyone who's got any, anyone with any self-respect, I think, would say, go first to him. You need the vaccine far more than I do. So try to think of it like that, like a queue, like these are actual people. It's not academic, it's not these are real people, and when you go and get your vaccine, so if you're in a wealthy country, I'm not saying don't get vaccinated, because the vaccines aren't going to go to anyone else. But if only there was a way to donate our vaccines to someone else. But we all need to get vaccinated. That is going to stop the pandemic in our countries. But we've got to tell our governments to give some of our vaccines to other countries, and let these people be in front of the queue, in front of us. The health workers around the world, the vulnerable people who are dying, the very elderly and the health workers throughout the world. Now that we are vaccinating so many people, then they should be getting that 5% of our vaccines. This is what France is calling for. So that's two things. Transferring the technology. If we transferred the technology in December, then they would have had the vaccines anyway, because they would be making them. Transfer technology now, and then they will be making their vaccines by the summer. And then the vaccines that we've already made through publicly funded through public funding, then we need to give a percentage of those to these countries that so desperately need them. And those are the two things that the World Health Organization say we should do. And I'm fully behind them. I think anyone rational, if you just stop and think about it, anyone's got a heart, anyone's got a warm spot in their heart for when they see other people are suffering, then there's just no way that they wouldn't say this. So anyway, so please try and spread the word. Try and explain this. We need more people to know this. I haven't seen this. I don't think I've actually seen this discussed on the news on the BBC. Not like I explained it. I haven't heard the word TRIPS on the BBC News. Have you? If you're in the United Kingdom, has anyone talked about TRIPS on the news, or talked about this vaccine inequity? I think there's some talk about vaccine inequity, but not the details, not the explanation of how we could do this. So please try and spread awareness and try and get some shift in our thinking. And basically, we can be, as an influencer, as a journalist, by sharing with other people, then you can help us to, the whole world, to make our first baby steps towards being truly civilized, as civilization would be understood by our descendants, our children's children's grandchildren, great-grandchildren, 1,000 generations in the future, then what they would consider to be civilized. And that wouldn't be technology, that would be stuff like this.